Greetings, dear listener. It is an honor to have you join the Motivational Fuel podcast. I'm Wondra Spencer, your host. I'm here to inspire and empower you. As a healthcare professional, a coach, I'm passionate about sharing valuable insights on strength, love, health, self-care, motivation, inspiration, lifestyle, finances, and personal growth. Our guests on this podcast will inspire you, and they will share personal stories, experiences, providing you with tools to unlock your full potential. I am thrilled to announce that the Inspiring Drive store sponsors this podcast. Check out my website and treat yourself to motivational items to help you reach greatness. Welcome to the Motivational Fuel podcast, your weekly dose of inspiration, empowerment, and real talk. Whether you're tuning in from my YouTube channel or listening on your favorite podcast platform, I am so grateful for your presence. Your decision to join this community fills me with joy. I am thrilled to have you here. I am your host, Wondra, the founder of Inspire and Drive LLC, and a firm believer in motivation from within. This podcast is designed to uplift anyone seeking stability, clarity, and a sense of purpose. I want to explore with you love, health, self-care, lifestyle, finances, personal growth, and spirituality. Alongside the incredible listeners like you, I share stories and insights that help you rise, reset, and refocus, both professionally and personally. So grab your coffee, tea, or water, take a deep breath, and let's fuel your drive from the inside out. Today's episode, September is a Prostate Cancer Awareness Month. And this is a new episode that I want to share with you. And it is what every man should know about prostate cancer. This topic engages everyone and is for all individuals, all races, all men can participate in this discussion. It is time to do it. If you're listening to this podcast and it's not September, I want you to still encourage yourself to get a checkup with your provider, encourage your family and your friends because your health is important. Your action calendar, month over month, so you can stay active. January, schedule your annual checkup. In March, you can join a support group, watch some webinars. In June, revisit your lifestyle goals such as nutrition and exercise. In September, the Prostate Cancer Awareness Month, you can share resources, podcasts like this one, and you can wear the color blue. I will share information about risk, symptoms, diagnosis, treatment, And you can support each other with letters, cards, and just listening to that individual. If you know about prostate cancer, you can send me an email, a direct message at Wondrous Spencer, or email support@wondrousspencer.com, where there is a lot of conversation about breast cancer. We can see these campaigns and ads on the television and throughout social media. So the topic around prostate cancer, it can be in the shadows. The difference is a lot of people don't know about it. They don't know about the symptoms or treatment available for prostate cancer. And men, they just don't talk about it. Prostate cancer is the most common type of cancer that's affecting men, yet it often receives far less attention compared to other cancers. But it is critical to raise awareness about this disease, educate oneself about risk factors, and encourage open discussions to promote early detection and effective management. We are shining light on this topic because it affects millions. It can be overlooked. With the men in our lives, we want to support them. We want to share the early detection, the awareness. If you are a prostate cancer survivor, thank you. If you're a caregiver taking care of someone, thank you. If you definitely want to learn more about this topic, this conversation is for you. So please keep going, share your story, and support each other because you got this. What is prostate cancer? Prostate cancer is a malignant tumor that develops in the prostate gland. It's a small walnut-shaped organ in men that produces the seminal fluid to nourish and transport semen. The cancer.org, some of the statistics from 2018 to 2022, the ages ranges in men from 65 to 74. The mental age is 68. So prostate cancer is the leading causing death of men. I repeat, it is the leading causing death of men, which is prostate cancer. This is definitely an eye-opener for me. It is not being discussed and it needs to be addressed. Some of the myths and misconceptions, you hear some people say prostate cancer only affects older men. If I don't have any symptoms, I'm fine. Screening is painful or unnecessary. Only family history matters. I encourage you to take proactive steps for your health. So who's at risk? Any man that is over the age of 50 that has a family history of prostate cancer, I want you to make your medical appointment quickly. So if you do some math, 2025 minus 50 is 1975. So 1975 and older, if you have a family history of prostate cancer, call your provider and get a scheduled appointment. You can review your license or identification because you can forget your age and it will have your birth date on it. Black men, African American men face a significantly higher risk of diagnosis and dying from this cancer. So look this up because a lot of people don't know that. But Black men, African American men face a higher risk of diagnosis and dying from this cancer. If you have a family history of prostate cancer or breast cancer, if you have different genetic mutations, you can ask your provider about it and seek genetic counseling if you have a family history of it. Your different symptoms, they can be silent, but early stage of prostate cancer usually have no symptoms, which is why screening is vital. As it progresses, your symptoms may include painful ejaculation, blood in the urine or semen, difficulty urine or a weak urine flow, bone pain. That means that it's in the advanced stages. And how it's diagnosed, which is your PSA, your prostatic specific antigen levels. That's a simple blood test where they will take the blood from you, and it's mostly by the prostate that may be found an increased amount of blood in men that has prostate cancer. The level of the PSA may be higher in men, which is an infection or inflammation of the prostate, or the BPH, which is the benign prostate hyperplasia, which is an enlarged non-cancerous prostate. And with this condition, it is located in the prostate gland, which is below the bladder in men. It enlarges over time, and the enlargement can put pressure on the urethra, the tube that carries urine from the bladder to the outside of the body, and it can lead to urinary problems, so which is frequent urination, difficulty starting or stopping urination, a weak urine flow, like trickling urine, and it feels like the bladder is not empty. So that's your PSA blood test. Your digital rectal exam, that can check for anything abnormal. Your doctor can put on a glove, put some lubrication on the finger, and check your rectum, and feels the rectum and anus and the prostate in males, and checking for anything that's abnormal. Your biopsy, it confirms cancer and determines the aggressiveness. Your imaging, which is your MRI, your CT, or your bone scans, that can reveal the spread of the cancer. Your different treatment options. So your treatment demands for this cancer stages and aggressiveness, your active surveillance for slow growing cases, your surgery, your prostatectomy, which can remove all or part of your prostate gland, your radiation therapy, hormone therapy, your cryosurgery is a cold liquid nitrogen that freezes away the cancers. Your chemotherapy, immune therapy for advanced cases. They do have many clinical trials, to talk to your provider, and they have a ton of new terminology and technology that's available, and you can ask your provider about it. So make sure you explore all of your treatment options. So you can seek support from prostate cancer. Your education can be understanding the diagnosis, your treatment, the side effects, and it definitely empowers you to be informed about the choices. You can ask your provider to write down and print out all of your information. And the Prostate Cancer Foundation, it provides webinars. You can listen to patient stories and seek support groups. The emotional and peer support, your support groups, they can be online or in person. They are a safe space to share your fears, your victories, and your advice. And don't be afraid to join the local and online and in-person support teams. And you can benefit from these by connecting to others who understand the emotional toll on supporting a loved one. You can listen to each other, emotions, listening without any minimizing or validating. Your family can support you by small and simple gestures, by sending a text, flowers, or even performing acts of service. If they are someone who has cancer and they're still working, you can support them, and you can talk to your employer and see the steps that they have in supporting you with prostate cancer and any support groups, because they are there. So simple yet some powerful acts of supports in your text messages. If you're checking on someone who has prostate cancer, you can add thinking of you. You got this. Let me know if you need anything. I'm here. I just wanted to remind you of how strong you are, or even just a short message to someone to let them know that they are not alone. So you can send flowers and care packages, a flower with a card on it saying for your strength, your hope, and healing. You can write a special letter. You can send something through the mail, online. They have these online cards. And you can send a box with different snacks in it, some cozy socks, journals, puzzle books, or even a nice book to read. And you can include something personal like a photo, a memory to lift their spirits. Even packing a basket of apples, bananas, fruits, different things like that. Your acts of service can be offering to drive them to and from their appointments or picking them up from their appointments. You can cook a meal or drop off some groceries. You can help with different errands such as child care or dog care. We can ease their load. Or you can just sit and listen and say nothing, because this is some critical and valuable time, and it will lift their spirits. Even cleaning their home, that can be helpful too to that individual. The clinical support, you want to have a strong team of providers, nurses, social workers, supportive family members and friends, and mental health professionals. And just be open and listening to their communication, because it can make you feel seen and heard. Share your complex decisions, your information. And if you do not have that support from your providers, the healthcare professionals, families, and friends, find that support so you can support yourself. Your self-care and lifestyle support. This can be with your nutrition, exercise, and stress management. It can take a role in seeking recovery and long-term health. You can walk 30 minutes a day once you're feeling great too. You can help with weight loss, stress, anxiety, and you can take that time to think for yourself and just to relax. You can take the time to de-stress by doing these things such as smelling the fresh air, getting 8 hours of sleep, practicing relaxation. And you have your mindfulness practices such as your counseling that can help you manage anxiety and depression. And you can try meditation. I have a quick 3-minute meditation that's on my YouTube channel. It's about 3 minutes and 2 seconds, and it is on YouTube that you can check out. So your support, if you're supporting someone that has prostate cancer, you can ask, what do you need today? Say, I am here to listen. Remind them that they're not alone in this process. Mental health, make sure you check on their and your mental health. Create a space to talk about the anxiety around the diagnosis and depression during treatment. Men, they can discuss manhood and openness. Therapy and counseling can help too. So it is time to talk about prostate cancer, because many men do not want to talk about this type of cancer. You want to make sure your family, your friends are there in your life so they can be healthy and enjoy the life experiences. The action plan is to share some of these tips with the men in your life and encourage them to share with others. Contact your local provider's office, share an appointment. If needed, bring a support team with you. If you cannot get into the doctor's office, a lot of times the providers, they're changing their appointments to the weekends to support all of their high volume scheduling and to help every patient that's on their schedule. Before you visit your doctor, write down all of your medications, your aches, your pains, anything that you're going through so your provider can support you. And take a support team. Maybe you're not understanding or you're not in the mood for it. Take someone that can meet you at the location or can take you there. Just build you a great support team. And put this appointment at the top of your list because your life and your health matters. Whether you're a survivor or a caregiver or simply someone who wants to learn more about prostate cancer, please visit prostatecancer.org. I want you to please keep going, share your stories, support each other because you can do this. You can review the cancer.org and search for prostate. Let's help each other this month and other months. Please take a picture of you wearing your blue and supporting prostate cancer with the hashtag Blue Ribbon Challenge and tag it to my podcast. Thank you for listening to this podcast and your ongoing support. Get ready to celebrate National Human Resources Day. I invite you to share a special update highlighting the remarkable contributions of your HR team. Let's come together to showcase their hard work and dedication. You can purchase my books on my website and at local retailers. And I want you to remember you have this. Your power, your story, and your spirit matters. The podcast is Motivation from Within, brought to you by the Inspire and Drive team. If today's episode spoke to you, subscribe to my YouTube channel and my Motivational Fuel podcast. And it is on many stations where you can subscribe. You can follow me on Facebook, Instagram, TikTok, X, LinkedIn, Alignable. And you can look me up at Wondrous Spencer. I see that my listeners are tuning in from all around the world. I am so grateful for each and every one of you. You can see my email, direct message, and I will send one back to you. And I can even shout you out on the next episode. So for my prostate cancer survivors, thank you so much for listening to this. I hope this uplifts your spirits and share your story with others. Until next time, protect your energy, honor your growth, and keep driving forward. Have a great day. If you have listened to this entire episode, thank you so much. I hope you enjoyed it. If you did, please leave a review and share with those who's interested. Let me know which topics you want me to cover in future episodes. You can contact me through my comments or on my social media networks. And you can purchase items on the Inspire and Drive store. I will look forward to seeing you next week for a new episode. Have a great day and remember to motivate yourself.